My research is the stroke. It's experimental stroke with a translational edge, which means that the goal of the research is to find a new mechanism of some aspects of stroke, and then try to develop a new therapy that can be introduced into the clinic. The greatest challenges in stroke, I would say, is in four areas. One is prevention, to prevent stroke. The other one is recanalization, to allow blood to open up the vessels and reperfuse areas where no blood has been present for some time, and then to protect the brain after stroke. And finally, the fourth area is rehabilitation and brain repair. So in the area where I work is in the repair area, and that area is to find new ways to reactivate the tissue that remains after a stroke once damage has matured and the damaged tissue is removed. It's seldom that you actually do a discovery yourself. It's something that is going on in the research community, and then you're part and providing a building block to this discovery. And that is, I would say, the importance of decreasing brain temperature by a couple of degrees, which provides a robust protection. We and American scientists could demonstrate that decreasing brain temperature by 3 degrees robustly protected the brain against cardiac arrest-induced damage. 15 years later, this is now introduced in the clinic and used in almost all Swedish hospitals as a standard treatment for cardiac arrest patients. And there is a big European clinical trial going on right now in stroke patients. So I would say that is something that I've been part of from the beginning to the clinical implementation. The short-term goal of our research of my research group here, and we are a couple of people working on it, is trying to revive and reactivate the surviving tissue after a stroke. So once a patient has suffered a stroke, tissue is lost and function is lost. But what is also evident is that the remaining tissue of the injured part of the brain is depressed. Somehow activity in this part of the brain is decreased, but we have now quite clear evidence that it is possible to reactivate and make use of this tissue to compensate for the tissue lost. And right now we are working with a couple of pharmacological tools that can be important and can be successful in this quest. The long-term goals of my research during my lifetime, I suppose it's my lifetime as a researcher, is to introduce the findings and the new therapies we have discovered in the preclinical research and the experimental research into a clinical trial. And I think that is feasible, actually. My driving force in research is absolutely the fact that you see new things every time you come to the lab. I'm actually working in the lab with practical research, so I have a look on data as they emerge, and the feeling of seeing new data, some surprising, some depressing, is a merry-go-round, or whatever you call it, ups and downs, and that's great fun.